My name is Peter Gøtzsche. I'm a director of the Nordic Cochrane Center in Copenhagen and professor of research design and analysis at the University of Copenhagen. In 1999, a Swedish study was published in the Swedish Medical Journal in Swedish by two people who said we cannot see that mammography screening, which Sweden has had for 14 years, has had any effect on breast cancer mortality. So this created a huge interest in the Danish Medical Association that asked the Danish National Board of Health, what should we believe? The randomized trials that tells us that screening works, or the Swedish observational study where they can't see any effect? So that was a hot potato that immediately landed in my lap. So people wanted me to review the randomized trials. And there were votings in Parliament 5 weeks away only about should Denmark have mammography screening in the whole country. We only had screening in 20% of the country. So my statistician and I worked very fast. We did a report in just 4 weeks in order to give the politicians information before the votings. And we concluded that we actually didn't know whether mammography screening did more good than harm, and we couldn't exclude the possibility that screening did more harm than good because it found many cancers that should not have been found because they are not dangerous. This is what we call overdiagnosis. So the director of the National Board of Health now had a hot potato, and he promised us that he would send our report to the minister who was against mammography screening. It never made it from the National Board of Health to the Ministry of Health to the minister. So people voted without knowing about our damning report. And they voted for introducing screening. But politicians out in the regions in Denmark were still skeptical. And the leading politicians said, what should we now believe? We have a lot of respect for the National Board of Health that recommends screening, but we also have a lot of respect for the Nordic Cochrane Center that I direct. So what would they believe? So they refused to introduce screening despite a parliamentary vote. So for the next 17 years, we still only had screening in 20% of the country. This enabled us to compare screened regions with non-screened regions many years later. And guess what? We confirmed the Swedish results. We couldn't see any effect of mammography screening in Denmark. Breast cancer mortality went down, but in the whole country, also where we had no screening. And this coincided with the introduction of very effective treatments, chemotherapy, tamoxifen, and so on. So breast cancer mortality started to go down all over the world when effective treatments were introduced. We have looked at other countries. It has nothing to do with when screening was introduced. So we found out in just 4 weeks, 15 years ago, that mammography screening might not work. And we have done research on that ever since and can now substantiate, yes, it likely doesn't work because it doesn't reduce the incidence of advanced cancers that have spread. And this is the whole idea of screening, to find cancers before they have spread. And many international studies have shown that this doesn't happen. And we have shown that it doesn't affect breast cancer mortality in Denmark. And it actually kills quite a number of healthy women because they are overdiagnosed. They should never have, their cancer should never have been detected. But since you cannot distinguish between harmless cancers and dangerous ones in the microscope or in other ways, then you need to treat all of them. And when you treat healthy women with radiotherapy, it kills some of them. They get lung cancer and heart disease and other cancers. So if you look at total mortality, we can't see any effect of screening. If you look at total cancer mortality, remembering that radiotherapy causes cancer in healthy women, you can't see any effect whatsoever. So my conclusion is screening should be stopped because it's harmful. Also because a quarter of women will get a false positive diagnosis. They will get a suspicion of a cancer that is rejected. And a Danish study has shown that they are very worried even 3 years after they were declared free from cancer. And in the United States, it's much more. It's about double as many women who get a false positive diagnosis because you are more aggressive here in the United States. So if you factor in this loss of quality of life in these women, you get a very negative result out of screening since it doesn't affect your mortality. So it's unequivocally harmful. We must stop this, just as we don't recommend prostate cancer screening in Europe. If a woman comes to me, and that happens sometimes, and asks me, should I go to breast screening? I tell them not to, because it is harmful. Their chance of living longer is not increased, and they might get treated for something that is harmless, and they might get worried about false positive diagnosis and all sorts of things. So they should stay away from screening. And they shouldn't examine their breast regularly every month, for example, because we have studied that. It doesn't work, but it doubles the number of biopsies. And this causes a lot of anxiety as well. So it's harmful to examine yourself once a month. So what women should do is, if they detect something abnormal while taking a shower or whatever, they will consult a doctor. That's what women have always done. And that is what they also should do now. They should not attend screening. You know, screening detects so many harmless cancers that we have calculated that screening increases the number of cancers by 50%. So if you had 100% in the old days, then you have 150% now. So if you don't go to screening, this is the best prevention against breast cancer that exists, because then you reduce your risk of becoming a breast cancer patient by 1/3, because you go down from 150% to 100%. That's a reduction by 1/3. It's the best. It's so ironic that women hear all the time, and with pink ribbons and walks and runs and so on, oh yeah, they must go to screening. No. The best way to reduce your risk of getting breast cancer is to say no to screening. This is deeply ironic.